As fall approaches, for many, it will be time to think about getting flu shots and COVID-19 shots. CTV's medical expert, Dr. Marla Shapiro, is joining me this morning with more. Good morning, Dr. Marla. Good to see you. So there are updated COVID shots approved in the U.S., not yet, though, here in Canada.
Nope. Not yet in Canada.
So hang on. Right?
Really hang on, because the XBB, which is the strain that we would have been vaccinated against, or you may have been boosted in the spring, this is not what we want you to be taking. There are updated shots, both Moderna and Pfizer, and there's also an updated Novavax shot. Novavax is a different, it's not a messenger RNA, it's a protein subunit. So for the FDA approval of Moderna and Pfizer, and we assume here as well it will be for 6 months and older, the Novavax vaccines are indicated for age 12 and older, and that may be for people who really don't want to take another messenger RNA vaccine. But, you know, we've seen evolution, and as usual, COVID is very good at mutating, and it's mutated into what we now call this flirt variant, and it's called the flirt variant or the flip variants because of the way they've been named now. So the names are a little bit different. They're now after letters. And what we saw in the spring was this movement towards JN1, and now that's evolving to KP. So J goes to K and goes to P. That's how they're being named. And that's what we're expecting for the fall glut, and that's where the vaccines have been changed. They're no longer XBB.
Okay, so it's not like these other vaccines are harmful. They're just not as effective.
Not as effective.
They're just outdated, I guess.
Well, it's like last year's flu shot for this year's flu season. It's that type of analog. You know, if you had the vaccines, you have an element of protection, but not the protection we're recommending that you need for the variants that are now, you know, taking over and expected to really be here. Well, they're already here and continuing to go through the fall and winter months.
Gotcha. Okay, so what should people consider when it is available here in Canada? What should they be asking themselves?
So this is the season. It's happening. So what you should be asking yourself is, when was my last COVID vaccine, and did I have a COVID infection? So for the messenger RNA vaccines, we're saying at least 2 months after the last dose, which is a much shorter interval than what we used to say. That's what the Americans are saying. Maybe in Canada we'll say 3 to 5. We'll have to wait to see what NACI guidance is, our Canadian advisory group. If you've had a COVID infection, your antibodies will protect you for a while, but it's not unreasonable to get a newer vaccine 3 months after the documented COVID vaccine, the COVID illness that you've had. And that's COVID that you've had in, let's say, the last month or so, because that's what we've seen. Bear in mind that the recommendation is for everybody over the age of 6 months, but who gets into hospitals? Typically, what we always say, anybody over the age of 65, the highest mortality and the highest illnesses of those 75 and older, and infants under the age of 6 months. Remember, infants under the age of 6 months cannot be vaccinated. They're too young.
I don't need to tell you that there is this vaccine fatigue.
Yes.
Please remind us why it's important to get the shot.
So when patients come in and say to me, this is my 8th, my 9th, my 7th, I say to them, this is no different than seasonal flu. We get a flu vaccine every year. And what happens with flu vaccines and what happens with COVID vaccines is that our antibodies that protect us from the vaccine, they basically are going to wane over time. And the antibodies that we have from the previous vaccines, before these vaccines, not really the vaccines that are oriented towards this particular variant. This new strain, JN1 and KP1, it needs a vaccine that's aimed for it. We do have a vaccine that's a really good match for JN1 and KP1, and we know that the updated COVID-19 shots will do a much better job in terms of providing protection.
I just have a few seconds left in terms of spacing out the shots, Marla. Should you do that? Can you do it on the same day?
Flu and COVID, you certainly, flu, COVID, you can. As far as RSV is concerned, you know, the guidance still is to separate it by a couple of weeks. But basically, I say to a patient, am I going to lose you to come back for a second shot if I don't give them all to you today? So getting flu and COVID at the same time. We're still waiting for flu shots as well. That usually is the 3rd week in October, and we're hoping that these COVID shots are out there any minute.
Dr. Marla, thanks so much. Appreciate it.
Bye for now.